Welcome to day 2 of the Us Against Alzheimer's National Alzheimer's Summit. This year's theme is translating science into practice. Our conversation today will center on the latest developments in the field and how those developments can be actually made available to patients in their daily lives. Someone who knows a lot about taking action to have an impact on Alzheimer's is David Dolby. His family has been affected by Alzheimer's and is taking action to affect people's lives in a number of different ways. So he is an active technology investor, he is a philanthropist, and his family is investing in actual practices in San Francisco, which are affecting people in their daily lives. He's the CEO of Dolby Foundation and Dolby Investments. David is joining me today from San Francisco. David, let's start by talking about your family's longstanding commitment to fighting Alzheimer's. I know that you and your family's Alzheimer's is personal, so would you just tell us what has brought you to this fight?
George, thanks for having me. I'm glad to participate in the event. Our family was affected when my father first developed symptoms of Alzheimer's. He was a person who could visualize very complex electronics. He could design and invent things in his mind and then translate them into very precise electronics that were applied to the audio and music industry and eventually to the film and television industry. At a certain point, when he developed these symptoms, we realized that there wasn't an available disease-modifying therapy, and we needed to spring into action. We immediately started to support organizations that were on the front lines, serving families, thinking about the immediate crisis, and then came to realize that we had a major shortfall in the whole research spectrum of looking at basic research, translational research, and developing drugs that could hopefully, in complement to one another, address this very complex disease. For us, our approach that we took was to focus both on standard of care in patient care settings, addressing diagnoses, disease progression, as well as funding the basic research on the philanthropy. And in addition to that, we pursued a strategy of investment to help early stage companies bridge that valley of death as they think about what data package they need to attract institutional investment. I've been doing this since 2012. My father developed his symptoms in his late 70s and unfortunately died from a form of leukemia that did not allow us to see what the full progression of Alzheimer's looked like, but it was enough to get us sensitized to the issue and bring us to the table. Our participation in the field has really been one of the whole family. We've participated in activism, in marches on Capitol Hill. We've been to many walks with the Alzheimer's Association, and as well as hosting investment forums. We've made many direct investments, and I've built up a team with both neuroscientists and professional investors to help us look at this problem holistically.
So I thank you for your investment as a philanthropist in the Global Alzheimer's Platform, which was a spin-off of Us Against Alzheimer's. And so you were doing that for a number of years. So I'm curious as to why you thought that that was a useful philanthropic investment.
Well, when I decided to shift gears in my career and focus on neurodegeneration and more specifically Alzheimer's disease, I was really, I first started by scanning the field and speaking to as many knowledgeable people as I could. Many of them were clinical practitioners as well as research scientists. And I wanted to look at the problem holistically and think about all the bottlenecks, all the shortcomings, all the places where both better organization of people, better management of data, better solutions in the healthcare system could all come together to address this fight. Certainly with the Us Against Alzheimer's umbrella, you've done the same thing, looking holistically at where there were shortcomings in the field. And it was clear that certain areas large pharma companies and other commercial entities weren't springing into action fast enough. That's where philanthropy could really play an immediate role. It involved, thinking about patient recruitment efforts, thinking about efforts to increase federal and state funding for Alzheimer's disease, and thinking about the multitude of areas that needed more support, both financial support and organizational support.
Could you give me a couple of examples of where you have made technology investments that you thought are important to sort of manifest this theory of change?
Yeah, I mean, when we think about the number of patients who are impacted by neurodegeneration, and specifically Alzheimer's disease, but preceding that would be mild cognitive impairment, and all the sort of really subtle changes in both behavior, cognition, patterns of daily living. These are not easily detected by loved ones and caregivers. Sometimes the earliest changes are so subtle, we actually need technology to help us. And so I've really thought about, in part of my theory of change, is how could we address low cost, high quality, high precision diagnosis for the general population on the planet. And ways I addressed that included investing in computerized cognition assessment. I made an early investment in Cogstate, which is a New Haven and Melbourne, Australia-based computerized cognition assessment company, who've actually served the industry both with advancing the state of the art with computerized batteries of cognition assessment, but also in serving the whole market, which is still fixated on using paper-based scales, the same ones that perhaps even our parents were using decades ago, to help enrich and qualify the raters that are addressing the scales for each patient, so that we can actually get consistent assessment from one test to another. Another one was Hyperfine, which is a portable MRI machine, which is now something that's available on the market, FDA cleared, and is able to deliver MRI without a dedicated shielded room, something that can be effectively offering the same precision of 1 and 1.5 and 2 Tesla magnets, but at a much lower field strength with much higher noise reduction and signal processing to deliver a quality MRI image at a fraction of the price. Coupling to that, we've got a preclinical company that's just actually going through its safety studies, first in man proof of concept, called Alzheimer Biosciences, that's developing an MRI contrast agent to bind to amyloid, and they have a pipeline of other proteins to bind to generate a contrast image for MRI. So when you couple a contrast image with a contrast agent for MRI with a low-cost MRI machine, you've got effectively something equivalent to a PET scanning, but that could be delivered at a much lower cost. One issue I didn't mention about computerized assessment is the natural accessibility of it, being able to deliver it on apps and computers, deliver it over the internet, and report it back to central data management systems for more immediate analysis and data collection. And sort of dovetailing into that, we invested in a study startup software company called Gobalto, which is now owned by Oracle, but was really effectively trying to shorten the time to deploy protocols for clinical trials, to organize the data fields, and to train all the fields, all the sites in the field on how to run clinical trials more effectively using technology. Let's see, in addition to that, we've looked at some emerging technologies like EEG. One of the shortcomings of EEG has been having to wear bulky head-worn caps with large wiring harnesses tied into computers. It makes it very impractical to wear an EEG system like that in the home. So we made an investment in NextSense, which is got an ear-worn EEG. It's something small enough that you can wear on your ear or both ears with multiple leads on each ear, and suitable for wearing over long periods of time, including overnight for sleep studies. So that we can really understand more about the whole patient over the whole duration and cycle of the day, week, and month. Those are just a few examples of where I think technology is going to deliver better precision, lower cost, and a better sort of holistic whole patient understanding.
Well, those efforts in early detection and diagnosis reinforce our pillar, which is basically early detection and early diagnosis to get lower cost techniques, more accessible techniques, not only to the American public, but we're now using some of Cogstate's tests in overseas locations. Because obviously, as you know, many of the cases of Alzheimer's around the world are overseas, as well as the United States, but also lower resource settings within the United States. So what you're doing reinforces one of our pillars of Us Against Alzheimer's, which is early detection and early diagnosis. So thank you for those investments. Give me a couple of examples of, with your hat as a philanthropist, and where you've put some philanthropic investments into some basic efforts that may not immediately pay off in any ROI as an investor, but where philanthropically you're moving the field as well.
Certainly, as a setup to the question, we've put the bulk of our dollars in for-profit investing into disease-modifying therapeutics, ones that hopefully represent diversity in the pipeline that move beyond the amyloid hypothesis. What we did realize in that scan of the field and available suitable investments was that standalone diagnostics, it's very difficult for those companies to attract venture funding, and as such, there's a long road to validation to paying for those studies. And then if there's just a single test, there was a chicken and egg problem, certainly over the last 10 years, that without disease-modifying therapeutics, there wasn't the same, let's say, market pull or demand for those individual tests. Fast forwarding to now, we've got wonderful tests that are available through CSF, blood, cognition, voice and speech consistency tests, all kinds of biomarkers that can be helpful in the diagnostics process. And so we decided to support the Diagnostics Accelerator. That was a large effort. It started out as a $50 million goal and eventually grew to a $100 million goal, where we've supported 10 million of that initiative, where that has been a 100% philanthropic gift made to ADDF, which is managing the Diagnostics Accelerator, running a series of calls for proposals, RFPs, that represent different modalities, both from fluid biomarkers to digital biomarkers and beyond. So that's one example. Another example, which has been much more, let's say, out in the community, has been supporting an initiative in the Alzheimer's Association, where they're training and engaging with members of different communities that will help spread the dialogue and the demand for clinical trials patient recruitment in, let's say, genetically diverse populations, in areas that can enrich the patient population coming through the door to screen for trials. And specifically, we're talking about African American, Latino, Asian communities, where if there's not sufficient information being disseminated about the merits of clinical trials and how that can really help us, there hasn't been a natural flow of recruitment subjects. So we've made an effort there. We've also made an effort with the Brain Health Registry, led by Mike Weiner. And really, I think it was an offshoot from all of the wonderful work being done at ADNI to help identify the need for broad whole patient population representing, for a single patient, taking data collection on many endpoints, including patient history, on cognition assessment, and other risk factors, along with building up and enriching the patient population for better genetic diversity leading into that. And then the last thing I'll talk about is something that relates to the place where people affected with dementia often end up and have the worst experience possible, which is the emergency department. My father had to go to the emergency department a number of times in his 70s, and each time it was clear that we did not have emergency departments that were geared up for people who had cognition problems or dementia or neurodegeneration. And as such, we've funded 3 pilots at 3 local hospitals in San Francisco, UCSF, Kaiser, and San Francisco Zuckerberg General Hospital, where they're actually rolling out new protocols and in some cases new dedicated facilities just for that geriatric population. So the geriatric emergency department is another area that I believe can also serve as a great safety net, a place where people can get better tailored care for their needs, sensitive to the fact that they've got memory and cognition concerns, but also a place that may be able to do an initial sort of cursory screening that, hey, this patient not only needs a different format of care, but also we may want to follow up with them and give them a referral to a neurologist. And I actually do have one other example where philanthropy has played a role for us to help drive our theory of change, which was you all too often hear about neurology practices being so full that they can't take new patients for weeks and sometimes months. On top of that, when they do see their patients, they're totally limited by what the system will compensate them to do. The amount of time allotted in the appointments is short, and the quality of the total assessment is rather cursory. And so my mother actually teamed up with one of my father's neurologists to rethink, what the whole pattern of care would be in a neurology office, and think about what sort of supplemental services could be delivered in that same setting, both to patients and their families. And from that, they created the Ray Dolby Brain Health Center at California Pacific Medical Center in San Francisco at the Davies campus, and it subsequently rolled out into some other locations where they've seen patients. And the whole idea was spend more time with that patient, both on the initial assessment, but in all the follow-up visits, support the administrative time to follow up with patients and their families, see how they're doing following the visit, really provide as much information as possible around what it actually means to go through a diagnosis and to prepare for the future, both to get a family's affairs in order, but also to think about their, let's say, psychiatric health, and to prepare the whole family for what really does feel like a crisis that many are totally unprepared for. Our family took advantage of similar services at the time, getting counseling, meeting with other families who've been dealing with the diagnosis, and really experiencing the care and character of wonderful neurologists who wake up every day to help patients and their families. And now that we're where we are today, we actually have more therapies to prescribe when appropriate. And the hope is that both patients are going to get lined up with the best therapeutics care possible, but also, if eligible, be referred into clinical trials, a place that is such an unmet need at the moment, given the time and effort and cost required to recruit patients into clinical trials.
Well, Dave, I commend you for all of your work. We're taking some of your work with the Diagnostic Accelerator and now developing protocols and use cases for primary and secondary care for blood-based biomarkers and digital detection techniques. So in a sense, we're working hand in glove and basically commercializing a lot of what you've invested in as a philanthropist. So thank you so very much for your work. Thank you, Dave, for being with us today. Thank you for your investments in the field as an investor and as a philanthropist. You are a family that has made a difference in this field because of your experience with this disease. Families rule. Families can move the needle, and you are one of the major families doing just that.
Thank you, George. I'm really inspired by my father's experience and by all the researchers who are working on this terrible disease, all the people working in the field to serve patients, and all the people behind the scenes trying to get these great opportunities funded. Our family's been touched by it, and we're here for everybody to try to make a difference. Thank you for having me today.
I appreciate your time. We're going to take a short break, and we'll be back with our next panel at 1:30 Eastern. So please stay with us.